Hi, my name's Phil. I like talking about politics. In this video, I'd like to discuss how the government are getting to airbrush out of history their failures during the coronavirus emergency. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So, the coronavirus crisis is over, at least the worst of it, or so the government tells us, if we can go along with that. Now is the time, as I say, for them to expunge any blame that can fall on them so that they don't have to cop any political payouts for their botched handling of it. Enter the careful choreography of the government inquiry. And of course, there are going to have to be inquiries into various aspects of this. And it's perfectly normal, during emergencies, it is standard procedure to hold inquiries. It isn't necessarily something to be linked with an emergency that the government have failed to handle well. They can have handled it as well as can be expected. You would still hold inquiries. During tough times, particularly unprecedented ones, there will always be missteps. Even with the best of intentions, lessons to be learned for future events. So, there's nothing to be worried about when it comes to an inquiry. And pandemics are increasingly likely with our connected global network of billions of little germ carriers, otherwise known as the human race. And any decent government would be keen to learn those lessons and implement the recommendations in full. But that is not the government we have, and the government we have absolutely has things to fear from these inquiries. Not only have mistakes been made, but deliberate acts of sabotage to our ability to cope. There is no way that a wide-ranging independent inquiry could possibly conclude that the government only made mistakes which could have been known through the lens of hindsight. In fact, they'd get a right hiding in the eventual report. Well, that's no good, is it? So the inquiry can't really be independent and is going to need some pretty tight guidelines. And there's already been a worrying but hugely predictable, quite frankly, report about the inquiry into the deaths of NHS workers, just one aspect of the inquiries that's going to be needed. So the Chief Coroner for England and Wales has said, and I quote, "An inquest would not be a satisfactory means of deciding whether adequate general policies and arrangements were in place for provision of PPE to healthcare workers. This essentially means that the inquiry isn't allowed to look at the failure to provide PPE as a factor in the deaths of healthcare workers. Needless to say, this baffling set of blinkers to be provided for the investigators has been attacked by the opposition, including Falconer, who's the Shadow Attorney General, who himself has been an Attorney General in the past, so will be well used to what an inquiry is and is not suitable for. And it's not as if anyone would be saying that no workers would have died had they had adequate PPE. Healthcare workers have died in other countries that had access as well. I mean, Italy, for example, yes, they got off to a slow start as well. But they don't just have a high rate of deaths in general, but also of medics. And they are not getting anywhere near as much blame as the British government would be. But PPE provision is clearly not only a factor in deaths, but has to be a major factor for investigation. Given that the whole point of PPE is to avoid the spread of infection, you cannot conduct any sort of analytical investigation into deaths caused by the infection without considering the measures put in place, or not, as the case may be, to reduce the spread of that infection. And when looking at the causes of healthcare worker deaths, it's not just about the infection spreading either. It's not just that you would only focus on this. Once infected, then you also need to investigate how early they were tested. That'd be part of it. And when tested positive, were they given adequate care? In other words, were they given the medical care that they have been providing to others throughout their working lives? And when we know that until literally a matter of days ago, many were not being tested at all, and some of these people were left to die in their own homes without receiving adequate medical care, I'm guessing that there's also going to need to be further guidance to stop investigators looking at those aspects as well. But it is just a very early pointer as to how the government are going to seek to airbrush this part of their history. It's no different, for example, to the secret investigation that was carried out into bullying claims against the Home Secretary that found her completely innocent without any independent scrutiny at all. So not only is this a pointer for how the government clearly intends to proceed to learn no lessons at all from this fiasco, and more importantly, make sure we don't learn lessons either as a voting public, but it is also an early challenge to the new opposition. How effectively can the new Labour leadership shine a spotlight on how ridiculous a position it is to hold that you don't investigate all the things that clearly had an impact on the deaths of these workers, especially when lockdown measures are eventually eased and we move into normal life, or what will be the new normal if it ends up being that. But that is the situation as it is now. Needless to say, I'm going to be keeping an eye on any guidance for other inquiries, or indeed further guidance for this inquiry as it's announced. In the meantime, I hope you found the video interesting. If you did, don't forget to click the like button, and if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.